Welcome to the Psychology Talk podcast. We are your hosts, Dr. Scott Hoy, clinical psychologist,
and Kyle Miller, licensed counselor. Psychology Talk is a unique conversation about psychology around the globe. We speak with psychology experts to keep you informed about current issues and trends. We advocate toward reducing stigma and educate about mental health.
While you're listening, please take a moment to give us a review and subscribe on Apple Podcasts, Spreaker, or your favorite streaming service. It helps us to continue providing you with quality programming. And now, enjoy the episode. Hello, everyone, and welcome to the Psychology Talk podcast. Today, my guest is Dr. David Spiegel. Dr. Spiegel is the Willson Professor and Associate Chair of Psychiatry and Behavioral Sciences, Director of the Center on Stress and Health, and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine, where he has been a member of the academic faculty since 1975. He was the chair of the Stanford University Faculty Senate from 2010 to 2011. David has more than 40 years of clinical and research experience studying psycho-oncology, stress and health, pain control, psychoneuroendocrinology, sleep, hypnosis, and conducting randomized clinical trials involving psychotherapy for cancer patients. Today, he will be discussing a new interactive hypnosis application, Reveri. Dr. Spiegel, welcome to the show.
Thank you, Scott. I'm delighted to be here.
All right. Well, maybe you can, not everybody in the audience knows about your background, especially in the hypnosis world. Maybe you can talk a little bit about that to whatever degree you'd like, and then we can talk about the application, which is cool.
Thank you. I'm glad to do it. Hypnosis is something of a genetic illness in my family. My father, Dr. Herbert Spiegel, late father, learned about hypnosis when he was studying to be a psychoanalyst and psychiatrist, and was taught by a Viennese refugee, Gustav Schaffenberg, who had learned about hypnosis because he had a smallpox scar in the middle of his forehead. And he did forensic psychiatry and discovered when he was interviewing prisoners that they would suddenly sort of tilt their head to the side and close their eyes and act in a strange way. And they were shifting into hypnotic trances. So he got interested in it, volunteered to teach young army doctors how to use it. And my father wound up using it in combat in North Africa, helping people with acute stress reactions and with pain control. And when he came back, he was warned that a good psychoanalyst would have to give up hypnosis because that's what Freud did. But he had a terrific supervisor, Frieda Fromm-Reichmann, who said to him, "Herbert, I don't know why you're so precious about your reputation at this stage in your career. You're going to teach a course on hypnosis at the Institute, and I know you're going to do it because I'm going to take it." And so he wound up continuing to do hypnosis and doing psychoanalysis, but he discovered after about 10 years that he seemed to be getting better results with these relatively infrequent hypnosis sessions than with daily psychoanalysis. And so he developed that more and more, and the dinner table conversations were pretty interesting. I occasionally would get to see him make a film of a patient with hysterical pseudo-seizures who could start and stop the seizures with hypnosis. And so when I got to medical school, I signed up for a hypnosis course with Tom Hackett at Mass General Hospital. And the first patient I ever treated, I will never forget. I was doing a pediatrics rotation at Children's Hospital in Boston. And she was a pretty 15-year-old redhead in status asthmaticus, knuckles white, gasping for breath. She hadn't responded to subcutaneous epinephrine twice. They were thinking about general anesthesia and putting her on steroids. And I didn't know what else to do. So I said, "Would you like to learn a breathing exercise?" And she nodded. And so I managed to get her hypnotized. And then I realized we hadn't gotten to asthma in the course yet. So I came up with a very sophisticated suggestion. I said, "Each breath you take will be a little deeper and a little easier." And within 5 minutes, she's lying back in bed. She's not wheezing anymore. Her knuckles aren't white. Her mother, who was standing there, stopped crying. The nurse ran out of the room. And the intern came looking for me, and I thought he was going to pat me on the back and say, "Nice job, Spiegel." And he said, "The nurse filed a complaint with the nursing supervisor that you violated a Massachusetts law by hypnotizing a minor without parental consent." Now, Massachusetts has a lot of weird laws, but that's not one of them. And her mother was standing next to me while it happened. So he said, "You're going to have to stop doing this." And I said, "Why?" He said, "Well, it's dangerous." And that's one of the things about hypnosis. People either think it's ridiculous or it's dangerous. It's one ridiculous extreme or another, and it's neither. And I said to him, "You were going to give her general anesthesia and put her on steroids, and you think my talking to her is dangerous? She's feeling better." So I said, "I'm not going to tell a patient of mine anything that I know is not true. So take me off the case if you want, but as long as she's my patient, I'm going to keep doing this." Now, she'd been hospitalized every month for 3 months in status asthmaticus. She did have one subsequent hospitalization, but then went on to study to be a respiratory therapist. And I figured that anything that could help a patient that much, frustrate the head nurse, violate a non-existent Massachusetts law, had to be worth looking into. And so I never stopped. That convinced me that, while all my classmates at medical school had read the New England Journal the day before and came up with some new drug to try, very few people were saying to patients, "Here's a way you can use your brain better to help your body." And that's what I decided I would spend much of my career doing. And that's what I've been doing all these years. And,
wow. Yeah.
By now I figure I've used hypnosis with about 7,000 research subjects and patients. I've learned a lot, and I decided I wanted to share what I've learned with as many people as I can.
Awesome. Well, it seems like you're doing quite a bit of that at Stanford, and other teachings you've given. Yeah. Well, your father, you mentioned Herbert Spiegel, your father, he and you, I think, to a great degree, and some other folks have worked on and developed, collected a lot of data on the hypnotic induction profile. Maybe you can talk a little bit about that.
Sure. Scott, one of the concepts that my father really helped to develop is the idea of using the assessment of hypnotizability as a systematic and scientific way of making decisions about whether a given person was hypnotizable enough to make use of it. And about a third of adults just aren't very hypnotizable. And then if they are, how hypnotizable are they, and how do you approach them psychotherapeutically? So it isn't the same for everybody. And there are some people who are highly hypnotizable. They just go into the state. They immediately feel the psychophysiological effects, and they're basically saying, "Tell me what to do and I'll do it." There are other people who are less hypnotizable who can get a lot from being in the hypnotic state, but it has to be a kind of cognitive experiential negotiation where you explain to them why they're doing what they're doing. You get them to agree on the strategy, and you become a kind of partner with them in exploring their hypnotic potential. And both can be effective, but they're different approaches. And so the idea is to use this 5-minute assessment of hypnotizability, which I've done thousands of times, and we can do it remotely now. We published a paper recently on how to do it using Zoom. And it's a quick and reliable way of determining how hypnotizable someone is, and it's also a learning experience for the patient, because the idea is hypnosis is not really doing something to someone. It's not their losing control. It's teaching them what their capacity is and how to make the best use of it, how to control their own hypnotic experience. Mm-hmm. We have a paper in Scientific Reports that just came out in which we studied the idea of hypnosis as cognitive flexibility. What people fear of being, suggestibility, somebody being able to take control of them, is really a sign of their ability to absorb and affiliate with new points of view. And that's a good thing. Now, you can absorb and affiliate new points of view that aren't very good, and that's a problem. But you can also be more open to a different way of approaching a problem. And so combining that ability with a good therapeutic approach can be a powerful tool.
Okay. Well, yes, certainly cognitive flexibility is what psychotherapy in general is trying. You could say that's a meta goal, right, for all psychotherapy, no matter what umbrella you find yourself under.
Yes.
And so being able to kind of rate that in a person probably means that you can kind of it would be helpful to rate that for general psychotherapy as well, like to be able to see how amenable a person is, how open a person is to experiencing, so to speak, new possibilities.
That's absolutely right. But being sort of in tune with, in sync with their cognitive style can help you make the most of the therapeutic opportunities. And I agree with you that it doesn't necessarily have to formally involve hypnotizing someone, although you can get there faster sometimes if you do.
Yeah. I think I was speaking to somebody earlier today, and what's amazing about studying different types of meditation or mind-body techniques or hypnosis is that they all point to our capacity as human beings. Well, how cool the mind is, first of all, how cool it is, and how cool it is that we can learn, if we can overcome some barriers to it, we can learn to control our minds and have that, as you say, flexibility, or be able to shift and affiliate with different points of view.
That's exactly right. And that's a tremendous opportunity, and one that we don't take nearly enough advantage of. Yeah.
I think that maybe we're, like the other thing I mentioned earlier in this conversation was that maybe what we're doing is we're moving away from or towards at least maybe a decade of the mind rather than a decade of the brain, where you're getting down to the granular parts of things, but you're like trying to see what can people do,
I like that idea, and I think you're exactly right. Our major evolutionary advantage as human beings, other than the opposing thumb, which is a good thing, is the size of our brain and all the things we can do with it, but it doesn't come with a user's manual, and so a lot of times we don't realize what we can do with our brain. And we also have this kind of, just as you said, let's transition from brain to mind, and they're both important. We have this sort of bottom-up idea in medicine that the only way to fix things is incision, injection, or ingestion. We think of the body as a kind of car where you find the defective part and replace it or fix it and do it from the bottom up. But the control systems we have in our brain are truly amazing, and we can use them a whole lot better than we usually do. And, pain is a perfect example, where pain is a combination of something going wrong in your body and the way the brain interprets that information. And you can control it from fixing the broken leg, or you can do it also from changing the way you experience the sensation. And for your listeners, one simple example now is if you're sitting or lying somewhere listening to this terrific show, you have sensations in your bottom touching the chair or the bed that you're lying on, but hopefully you were not aware of that until I brought it to your attention. And if you were, you're welcome to listen to a different show. Mm-hmm. But most of the time, our brains are constantly helping us to filter in or out information and changing how it feels. Not just how much attention you pay to it, but what you're feeling. And that's a powerful tool.
Yes, but like you said, we don't come with that user's manual. And
right.
We have a society, I think in general, we have a society that's bottom-up oriented.
Right? Yes.
And, I think that we're not given permission to control our own minds.
Right.
And bodies, yeah.
Yeah. And we don't need permission, but we often don't think of it. So it's a matter of not beginning to explore the possibilities of how we can use our minds to better manage our bodies and experience things better and differently.
Absolutely. You're speaking of top down and bottom up. I mean, it's kind of like in psychotherapy or even behavioral science, the idea of like outside in versus inside out change, right? Doing something differently so that you can see that it's not going to kill you to go ask somebody to dance or out on a date or to do certain things, right? Sort of exposure to something that you're really worried about, and then realizing there was nothing much to worry about and you can do it.
Yeah.
It'd be outside in, inside out kind of, yeah.
Yeah, I think that's right. And the fun thing about hypnosis is it's more intense and it's faster. So one of the cool things is that you can learn within a matter of minutes doing hypnosis whether it's likely to help you or not. And if it is, use it. If not, don't. I had a young woman come to see me who had bad degenerative disc disease rather early in her life, had terrible back pain, and was pregnant. And of course, as the pregnancy progressed, she was in more and more pain because it was disaligning her back. And because she was pregnant, they didn't want to use medications with her, so they implanted a nerve stimulator that didn't help. And when she started with me, she finally got to me. Her pain was 7 out of 10. She was suffering a great deal. And by the end of a few minutes of self-hypnosis, imagining she was floating in a lake and feeling a sense of cool, tingling numbness in her back, the pain was down to about a 3. And she opened her eyes and she said to me, "Why were you the last doctor I got sent to instead of the first?" And so, we often, don't do the simple, safe things first and see if they work. And they don't always work, but when they do, they're terrific.
Yeah, well, absolutely. Absolutely. Well, maybe we can use this as a bit of a segue into this new application, this interactive hypnosis application. What can you tell us about that?
Sure, I'd be happy to. A couple of years ago, I was giving a talk about hypnosis at a mind-brain summit at Stanford. And a Stanford, MIT and Stanford Business School grad, Ariel Poehler, came up to me afterwards and he said, I think we could build an app around this. And we started out, he said, I've worked some with the Alexa platform, which makes it easy to develop interactive speech apps. And you want to try it? And I said, great, let's do it. And so we built an app, and we now have a little startup. Nobody who doesn't have a startup company at Stanford is considered, worthy of attention. So we have a little startup. It's called Reveri, Reveri. And what we're doing now is an interactive hypnosis app where I give instructions the way I would in my office. I wanted to do it to make it as similar as possible to what I actually do with my patients in the office. I ask how you're doing. Can you feel this or not? They give me an answer. We analyze it. And then we have a suggestion that's based on the nature of their answer. So it's interactive and it changes the set of hypnotic instructions depending on how they're responding. And we now have apps that deal with problems like stress management, enhancing focus, insomnia, helping people go to sleep or stay asleep, pain control, eating healthy, and stopping smoking. And each of the exercises takes about 15 minutes. And we have little 1-minute hypnotic minute refreshers for people to use as well. And I'm delighted to say that we've had something like 130,000 people visit the site. We have at any one time about 5,000 people engaged using it. And in general, 2/3 of them say, this is helping me. Right away, they know. Within 15 minutes, they'll tell us that their stress levels, which started out at 7, are now down around 4. We're getting about 30% pain reduction over 3 months with people using the exercise. We're getting about 19% stopping smoking. So it's just a joy for me to see that we can make these hypnotic techniques available to many, many people, and that a lot of them are benefiting from it. And what's really fun is people who use it know right away whether or not it's likely to help them.
It's a very, I have been playing around with the app. I'm intrigued by it. I've used other hypnosis apps that are not interactive, and it really works well. The voice activated yes or no or okay, or using a Likert scale to say how much pain you're having or how much stress you're having. It is a lot like having a session with somebody doing hypnosis. It's really personalized by that standard. Yeah.
I'm glad to hear you say that because you have a lot of experience using hypnosis too. So I'm very glad.
Yeah, absolutely. Most of my training was with a lot of people, Yeah.
Right.
you may have trained some of them, or trained alongside of them in certain capacities. So you're getting some data sets. It sounds like you're trying to collect some data. Obviously, you report these things. There's Likert scale. So can you go into a little bit more detail about that?
Sure. So we have one study where we got data on 15,000 people who signed on to the Stress app. And we got, on average, within 15 minutes, about a 30% reduction in self-reported pain. The effect size, which is a way of measuring the magnitude of the difference, is 1. And a low effect size is 0.2. A moderate effect size is about 0.5. A big effect size is about 0.8. So 1 is really huge. These people immediately report, on average, a substantial reduction in their self-reported stress. Wow. And so I'm very excited about the fact that we can get a big effect in a short time, and people can do it repeatedly over time. They retain the ability to get the benefit of the hypnotic experience. And the nice thing about the app, I used to in my office, Scott, use the smartphone to have them, use the dictation mode and record the hypnotic session I did with them. Yep. But that's sort of inflexible, because once you've done it with them, it's done and it's recorded, and they're responding to my talking, and it was okay, but it wasn't great. The nice thing about the app, about the Reveri app, is I'm there whenever you need me. It is my voice. And anytime you think, and I have people, we found with the insomnia app, for example, that people use it at 2 times. They use it in preparation for going to sleep at, late afternoon, early evening. And if they wake up, the biggest use is 2 to 4 in the morning. I'm not going to be available at 2 to 4 in the morning to help people get back to sleep, but I am there on the app doing it, and people really seem to benefit from it.
And also, you're saying, when they're it's kind of like Santa Claus. You're kind of like the hypnosis Santa Claus. When they're sleeping, when they're awake.
I like that.
But, so you're able to see. I mean, that's another data point when people are using it. For something like insomnia, obviously, it's usually when people will tell you to wake up.
Yep. And it's really nice for smoking. People can use it when they're about, when they're feeling the urge and they're thinking they might do it. They can sit down, go into the state of self-hypnosis and say to themselves, for my body, smoking's a poison. I need my body to live. I owe my body respect and protection. So they don't fight the urge to smoke. They focus on respecting and protecting their body. And I'm there to tell them that anytime they need it. And so that availability of the right exercise for the right problem, same for people with eating. We get them to sit down before a meal and commit themselves to eat with respect for their bodies, the way to feed their body the way they'd feed a child or a pet.
Yeah. Well, I think that I would like to touch upon a little bit about the induction, which is just a smidgen of that hypnotic induction profile with the 3 simple steps. But one of the steps is levitating your arm.
Right.
But it's a very direct command. The hypnotist in me says, are you really looking for a catalepsy, or are you looking for an anchor for later on when the person puts their arm up to kind of associate that experience, the entire thing, with a movement and a holding of a posture?
Part of it, it's a very interesting question, and part of it, in the classical hypnotic experiences, it is you sort of try to get the person to the point where the hand is up there. If they pull it down, it just wants to go back up by itself. And so you are observing a phenomenon that is very closely associated with hypnosis. Dissociating the arm, and the experience of lifting the left arm suddenly feels very different from raising the right arm. But it's also a discovery experience for the person themselves. You're saying, look, what in a few minutes you were able to do to your perception of an experience of your own body, that you could make your left arm feel so different from your right. And the nice thing is you have the comparison. You feel a sense of involuntariness. that you do it and the hand just wants to go up by itself. Then you give the cutoff signal and it goes back to usual. So the person can experience how much more control they have over their body than they thought they did.
Right. Yeah.
They can experience dissociation in a way that is not threatening or frightening. It's a way that they can learn from. And so we use it then as a signal to tell yourself, okay, I'm back in this hypnotic state now. How do you know that you are? Well, one way is that your left hand is feeling different from your right, and you pull it down and it wants to go back up. That's kind of fun, but it's also a signal. Here I am. I'm back here. I'm going to do it again. And so we use it as a way for them to learn about their own expanded domain of possibilities and how they interact with their own body. So it's a signal, is the way we use it.
Okay, excellent. The other thing is, the arguments. I think the arguments are done over the type of language styles, like paternal or maternal language styles or permissive language styles. I know that a lot of the language is very straightforward and direct.
Yes.
Have you thought about have you had any feedback about that, or do you care? I mean, you might not be in the crowd that cares one way or the other about that.
I understand it, and there are different ways of doing it. And you're absolutely right in the way you characterize our style. It is rather direct.
Yeah.
I don't have people count upstairs and downstairs and all that stuff. I don't take a long time doing it. And this is where the concept that my father introduced into the clinical world of adapting, there were laboratory measures of hypnotizability, but saying, look, I think a lot of the long hypnotic inductions are really a kind of imprecise way of measuring hypnotizability. So you see, can she respond to this or not? And then let's try something else. And it can take you 20 or 30 minutes just to go through all of that stuff. Whereas I think, and I've watched, the great Milton Erickson's tapes and all that, and I've watched him work with very and with not very hypnotizable people. And I think the money in this is in assessing how responsive the person is and meeting them where they're at, not trying to talk them into a hypnotic experience they're never going to have. And so I think the best thing to do is do it briskly and quickly, see how they can respond, and work with whatever level of response they've got. And you're not going to make a whole lot of difference by taking another 20 minutes, and you make the hypnotic process a whole lot more cumbersome and time expensive than it needs to be. And I think one of the real advantages we have is people will know within 15 minutes whether this is going to help them. And if it is, great. And if it isn't, fine, do something else. And to me, you're giving away one of the greatest advantages of hypnosis if you make it into a longer and more cumbersome process than it needs to be.
Okay. Oh yeah. Yeah. That being said, I do know that it's it's quick is fine. Yeah, I don't think, I think that you can probably speed, even if you're going to use permissive language up or try to kind of elicit and figure out how they like to do things. You could probably do it a lot faster than some people do it. But I mean, I guess the question was, have you wanted to tinker with that at all and maybe utilize the app to, I don't, that's kind of, this is kind of a strange question, I guess, but would you want to work on the app to try and elicit from them different imagery or different phrasings of imagery? I mean, it's a different algorithm for the app and it's more complicated. It's possibly unnecessary.
Well, I would say that where we do the tinkering has more to do with the therapeutic approach than with the induction itself. So my feeling is do the induction quickly, but then, so for example, in the pain app, we have 4 different ways of trying to modulate your pain. Mm-hmm. And one is to substitute a different sensation. So rather than focusing on the pain, focus on a sense of warm or cool, tingling, numbness, and filter the hurt out of the pain. Or we have people use dissociation. Just say, go somewhere else, leave your body here. Picture yourself on the beach in Tahiti and just enjoy that and let your body do what it's going to do here. The third is developing a sense of compassion for your body, because people get frustrated and angry with their bodies. Why are you making me so miserable? And if instead you think of your body as a child who's been injured, You wouldn't get angry at the child for being upset and being in pain. Don't get angry at your body for being in pain. Instead, be sympathetic and supportive. And the fourth is trying to manipulate the pain, move it around, think of it as an oily substance and see if you can modulate the experience. So where we do the experimenting, Scott, is more in the domain of the psychotherapeutic approaches, and that's important. And I might mention for the listeners who are interested that if they want to try Reveri, it's Reveri on the App Store. You can download it. At the moment, we're building an Android app, but we don't have it yet. We expect to have it by the fall. And you can also get into it on the web, www.reveri.com. So we welcome people to try it and see how they're doing. The first week is free. You can try it and see if you like it, see if it's going to help you or not.
I have to say, I'm rather impressed with it. It really, I think that you and the team have done a bang up job with it. I think it's great. And
thank you.
I will probably recommend it to patients and others who are interested in having something at their avail and in their arsenal, if you will, or their tool belt of mind-body techniques.
Thank you. I'm so glad to hear you say that. I really appreciate that coming from you, especially. We had one when we were working on the smoking app, and another way in which we use hypnotic language is, good people who use hypnosis always say, don't tell people not to think about purple elephants. That's what they're going to think about. Focus on what you're for, not what you're against. And so I don't tell people to stop smoking. I say, for your body, smoking's a poison. I need my body to live. I owe my body respect and protection. You focus on what you're for. You feel good. You don't feel deprived doing that. So we had one person who volunteered for one of our studies, and she smoked for 25 years. She said, I'm not going to stop smoking. She didn't particularly like it when we introduced her to the app in the lab, but she went home that night and tried it again. And she looked at a cigarette and said, why would I do this? And she hasn't smoked since. And she said to us, this is some kind of crazy ass voodoo shit. And she said, and I mean that in a good way. She said, my friends can't believe I stopped smoking. And she's now going around getting her friends to stop smoking too. So when you connect, you really connect. And I love watching the surprise in people when they discovered that they could do something they thought for sure they couldn't do.
Well, again, I think that the more we can engender that flexibility and just teaching people that they're cool, their minds and their bodies and their brains are cool, and they can do cool things with them. They have a lot more efficacy or self-control, boosts self-esteem.
I think so. And people are worried about it and being manipulated in some ways. I think of hypnosis as being dangerously effective. Can I quote you on that? Yeah, by all means.
All right. That's actually very good. I like that. It is dangerously effective. Yeah. Dangerously underused these days too.
Yes. Well, look, Scott, we have 100,000 last year in the United States, 100,000 drug overdose deaths. Yeah. And a big chunk of them were not suicides. They were just unintended overdoses with opioids, opioids laced with very potent opioids like fentanyl and carfentanil. Opioids kill people because there are two different receptors in the neurons that respond to opioids. One reduces pain and gives pleasure. The other suppresses respiration. And you habituate to the first one, but not to the second one. So people think, well, I can handle more because the pain is getting worse. And in fact, you get withdrawal hyperalgesia. If you take less opioids when you've been on them for a long time, you get more pain. But they think I need it because the pain is worse. And they go to sleep and they don't wake up because they're getting this overdose of opioids on their respiratory system. They're good drugs for acute pain, and they're very dangerous for chronic use. And so, how dangerous could hypnosis be? It's not killing 50,000 people a year, I can assure you. So, there is a tremendous need for us to do things that help people with real problems in real ways, but don't kill them.
Absolutely. Yeah. Yeah. Well, hopefully the Reveri app will be revolutionary for people and maybe pique more interest among the clinical side of things. Both MDs and behavioral health specialists and nurses could maybe find out more about this. Yeah.
I really hope so. And the idea is that you can use it to supplement whatever else you're doing. It's something that's available to people all the time that can help them and can add to whatever hypnotic or non-hypnotic treatment you're doing. There are good behavioral treatments, non-catastrophizing treatments that many pain clinics are using now. And you can use this to supplement it as well. And the nice thing is it may well help and it's not going to hurt.
Yeah, absolutely. Well, do you have anything else in the docket? I mean, you're a very busy guy. I know that.
I am, Scott. We're doing some research. The National Center for Complementary and Integrative Health has been very helpful in supporting our research. And you have raised this issue of hypnotizability and how we measure it. And is it changeable? Well, we've been doing some neuroimaging research for some time about what's going on in the brain with hypnosis. And we found a couple things that we think are pretty interesting. One of them is we just put high and low hypnotizable people on the hypnotic induction profile in the functional MRI scanner. And we discovered one big difference between the highs and the lows. The highs have what we call more functional connectivity, that is coactivity between the dorsolateral prefrontal cortex, which is part of the executive control network. It's what you do when you're writing a paper or giving a talk or something like that, and the dorsal anterior cingulate cortex. That's this sort of inverted C-shaped part of the brain right in the middle. Mm-hmm. And it is part of the salience network. So when you hear a gunshot and you suddenly shift your attention, that's your salience network saying, this could be dangerous. You better do something about it. And when you have coordination between those two regions, you more easily get absorbed in what you're doing because you're not worried about doing something else. So high hypnotizables tend to have functional connectivity between those two regions. So it's the kind of experience people have when they get so caught up in a movie or a play that they forget they're watching the movie and enter the imagined world. You're not thinking, the script could have been a little different and I'm not sure I like that actor and so on. You're just engaged. You're part of the story, not part of the audience. And that comes from this coordination between these two networks in the brain. The next. Oh, go ahead. I'll
No, you go ahead. I'm fascinated by it. You go ahead. I think I lost my thought, though. As you're talking, I'll try to remember my train of thought. I got
hypnotic amnesia. Yeah. So then we thought, well, let's see what happens when we hypnotize people in the scanner. So we screened 545 Stanford students and others and selected the most and least hypnotizable of those two, put them in the scanner and did 2 hypnosis exercises, one involving reliving good memories in your life, and the other is imagining being on vacation somewhere you'd like to be. And we looked at what happened in the brains of the highly hypnotizable people in the scanner in hypnotic conditions. And we had 2 control conditions as well. And we found that the highs in the scanner turned down activity in the dorsal anterior cingulate cortex. So they turned down their salience network. They were less likely to be worried about a threat or a danger or something else to be going on. And then there were 2 other things, which makes sense. You're just not worried about what else you might be doing. You're really engaged in what you are doing. There was more functional connectivity between the executive control region, the dorsolateral prefrontal cortex, and the insula. The insula is a small part of the salience network that is involved in mind-body control, in controlling autonomic reactivity.
Interoception.
Yep. Exactly. Your ability to perceive what's going on in your own body. That's exactly right. So if you're coordinating those 2, you can control pain better. It's part of the pain network too. Mm-hmm. And you can also experience changes in the way your body feels. So one way hypnosis is very good for stress management is to dissociate the experience of stress psychologically from the physical reaction to it. We're pretty pathetic physical creatures. We don't run very well. We're not that big. We're not that strong. We don't see that well. We see pretty well, but we don't hear or smell as well as many other animals. So our major survival advantage is the ability to fight or flee, to assess a situation and fight or flee.
Yeah.
The thing about that is that a lot of our threats are not immediate physical threats, but our bodies react as though they were. So your heart rate goes up, your blood pressure goes up, you start to sweat. And then you notice that and you say, oh my God, this is terrible. And then you get more anxious and then your body reacts to that. So it's like a snowball rolling downhill. Mm-hmm. In hypnosis, you can learn to dissociate one from the other. So you can be worried about something, but imagine your body is floating in a bath, a lake, a hot tub, or floating in space. And you begin to feel better. You haven't solved the problem or the stressor yet, but you're at least not reacting so much physically to it. And you begin to give yourself enough peace of mind to sort out what's the best way for me to react to the stress and deal with it. So we use that as a common stress relief technique, and it can be very effective. And in part because the executive control region is using the insula to calm the body, even while you're thinking about the problem.
Wow. Yeah. So again, it's cognitive flexibility and literally neurocognitive flexibility and plasticity, right?
That's exactly right.
But so you're really hitting on the ability to be absorbed in an activity.
Yes.
So like, I guess for those of you out there who really love the Tellegen absorption scale, do you think it like adds more credence to absorption as being a big chunk of hypnosis, correlation? That's why you get the correlation there, perhaps, or just why it's such an important, I guess, tool of human beings to be able to function and control our cars, so to speak.
That's exactly right. And I knew Auke Tellegen, who developed the absorption scale, and he was puzzled by the fact that hypnotizability is a very stable trait. It's as stable as IQ in the adult lifespan. You know, there's a study done. They found Stanford students who'd had their hypnotizability tested when they were undergrads in Psych 1, blindly retested them 25 years later, and the retest reliability was 0.7. Now that's stable.
High.
More stable than IQ over a 25-year interval. And so he observed that and used the scale to show that people who are more hypnotizable have more spontaneous hypnotic-like experiences. They get caught up in a movie, they get lost in a sunset, time passes when they're doing something they enjoy and they don't even notice it. And that points out that you don't have to have a long, elaborate hypnotic induction to have a hypnotic experience, especially if you're pretty hypnotizable. And so he made a great contribution to our understanding of what hypnosis is by doing that. And part of it is just exactly what you talked about, turning down activity in the anterior cingulate, turn down your salience network, connect with parts of that salience network when you're doing something. And there's a third component we found, and that is that the executive control network is disconnected from the posterior cingulate cortex, the default mode network. That's a part of the brain where when we're not doing something much, we're reflecting on ourselves. Mm-hmm. And that part of the brain has a lot to do with self-reflection, self-image. And it's why it's part of the cognitive flexibility in hypnosis. You're less worried about what it means that you're doing it. You just do it. And that's a part of the brain where activity is turned down during mindfulness. That Judson Brewer at Brown has shown that you reduce activity in that region when you're being mindful. And you're supposed to lose self-absorption when you meditate. And so that kind of makes sense. It's related to meditation, but it's different. You're disconnecting your executive control network from your self-reflection.
It's like, well, you obviously, I think somebody who would be adroit in creating a memory palace, right? Like the idea from Greece and mm-hmm. Middle Ages, right? To store memories mnemonically or visually.
Oh, yes.
In an imagined, somebody who was high on the hypnotizability and absorption would be able to do that in spades, as they say.
That's exactly right.
Yeah. Yep. So, and these are things that we've lost, largely because of that top down kind of attitude towards reality. Keep it in a book, put it on the internet. Right.
That's right. No, absolutely right.
Yeah. So lots of fascinating stuff there. You did mention the default mode network. I think that a lot mm-hmm. of the studies with psilocybin and LSD show that that's kind of there's both serotonergic mm-hmm. drugs that kind of like, if you will, reboot that default mode network with this huge cascade of serotonin.
Yeah.
So it kind of takes it offline for a while, and you get to look at things differently.
Yeah, there's the front part of the brain, the executive control network, has a lot of dopamine in it, and there's more serotonergic activity posteriorly. That's right. But, one of the things, and the psilocybin research has been very interesting. They've used it with dying cancer patients, and they find that, I would have thought that if I was dying of cancer, the last thing I'd want to do is take the risk of having a bad trip, and yet people come out of that with good supportive psychotherapy as well, saying, I saw my death, I could see it, but I just feel differently about it. And I've seen that in work using group therapy and hypnosis with dying cancer patients, that, one woman said that, talking about death in the group is like looking into the Grand Canyon when you were afraid of heights. If you fell, it would be a disaster, but you feel better about yourself because you can look at it. I can't say I feel serene, but I can look at it. So there's something about changing mental states that really powerfully changes perspective. And one of the amazing things about the psilocybin research is they only take it once or twice, but they feel different. They feel rebooted, as you put it. Whereas with most psychoactive meds that work, you have to keep occupying that receptor, or you lose the effect. And this is a different kind of psychopharmacology that's very interesting. And I think one of the ways that hypnosis works so powerfully is you very rapidly change your mental state. So you see the same problem from a different point of view, and you feel differently while you do it. And you learn that kind of cognitive and emotional flexibility, that you can engage with the same problem, but do it in a way that makes you feel different and makes you see the problem from a different point of view.
It's the question of metacognition, which I think is kind of like a huge, whether or not you're doing it intentionally. A lot of the techniques that we're taught in the behavioral health spectrum of things are to influence a person to think more metacognitively.
Yeah. I think that's right, that we tend to get trapped in the sort of usual circuits that we use and usual ways to approach a problem. And just being able to step above and see the same thing, but from a different point of view, changes your perspective for good. Yeah.
Okay, well, you're up to a lot. I don't think I'm going to put anything else on your plate, Dr. Spiegel.
I'll tell you, there is one other addition we've made to this. So one of the challenges we undertook with a great colleague of mine at Stanford, Nolan Williams, who's an expert in transcranial magnetic stimulation, is we thought, well, just maybe, we can change hypnotizability a bit by changing the functional connectivity between the dorsolateral prefrontal cortex and the anterior cingulate. So we used TMS in a group of patients with fibromyalgia. And we actually found that we could increase hypnotizability for a short period of time after they'd undergone the TMS, that increased connectivity between those two brain regions.
But wait a minute, stop the presses, especially on the International Journal of Hypnosis. So what you're saying is that it isn't that stable after all with neurocognitive, like with changes in neural connectivity.
Well, that's right. And we have the guy who was the first author on the cognitive flexibility paper, Afik Fireman, and I are working now on a paper showing that we could increase hypnotizability in 45 minutes more than it increases over 25 years in that earlier study. Now, it didn't remain. It wasn't something that we reset it and they're all more hypnotizable now. But it was a proof of principle that if this is the right circuit and you manipulate that circuit, you can change the way the circuit functions, at least for a short period of time.
Well, this is kind of out of the blue, but I think Charles Tart, didn't he have a paper or two about that where he said, this didn't make sense. This is a stable trait, but I'm seeing a fluctuation in depth of trance and potentially hypnotizability. Right? I mean, this is something that we've had evidence of even without MRIs or TMS.
Well, Charlie Tart was very interested in altered mental states and in drugs that induced altered mental states. And we still have a way to go. But I think at this point, what Dr. Williams and I think we've done, and Dr. Fireman, is it's proof of principle that this circuit is involved. And if you change the way it functions, even transiently, you can change the degree of hypnotizability. And one idea is that it might be we will couple TMS with hypnosis at some point to enhance pain control.
Yeah, I'm wondering, I know a number of patients who have alexithymia, which is they think now is more connected to problems with the insulae. Mm-hmm. Is there any way to correct that connectivity? I mean, behavioral modification is kind of difficult in long term.
Yes.
Typically, people, if they have problems with the insulae, they probably going to have difficulty with absorption. Under the rules of hypnotizability, that's what I've kind of noticed clinically. I'm just wondering.
Well, it could be
a terrible thing for somebody to deal with.
It's hard. It really is. The salience network and the insula's role in it is crucial in processing pain and discomfort in caring about something, but conversely not caring about something. And that's correct. What you see in alexithymia. Dr. Williams' group has had tremendous success using TMS in that same region, actually, for treating depression, for treating suicidality. We're doing a big study on Stanford now with that. And we actually have a TMS machine in the emergency department. So people who come in acutely suicidal now get TMS treatment. And sometimes within hours, they feel better. Sometimes it takes more treatments over more time. But intensive stimulation of those particular brain regions may actually have an effect on the parts of the brain that modulate how much you care or worry about something, how depressed you are, and how suicidal you are. So I think it is a brave new world in psychiatry now where we can do this non-invasive neuromodulation and make a big difference in how our brains work.
Wow. That's exciting stuff, all of it. Yeah.
It's fun.
Well, I want to again reiterate that the app is called Reveri. And where can people find it?
They can find it by just go to the App Store, look for Reveri, Reveri, download it and open it up. And you'll see how to use it. You'll see the types of problems for which it can be helpful. Give it a try, see if you like it, and if it helps you. We're very excited about seeing if we can help people remotely in a way that so far our studies show is happening. Okay, and excellent. You can also go to www.reveri.com on the internet to get more information about it as well.
Excellent. Well, I can vouch for it. It's the real deal. It's good stuff.
Great.
Thank you so much, Dr. Spiegel.
Thank you.
And take care. I hope you can come back sometime.
Thank you. It's been a pleasure talking to you.
Thank you for listening to the Psychology Talk podcast. Did you know you can find us on the web all over the place? Well, maybe not all over the place, but you can find us on Instagram, you can find us on Facebook, you can find us at Spreaker, Stitcher, Apple Podcasts, loads of places. Please look for us, and if you can, subscribe, like us, leave us a review, send us a comment, a criticism. Hey, we like to hear a lot from people. Go ahead, talk to us. That's why we're here. By the way, this is just a reminder to let you know that all of the material here is for entertainment and informative purposes only. If you do need a therapist or a mental health professional, please seek one out. Music is provided by the band Serenati.